Hello, Ms. McAllister. My name is Danella. I'm going to be doing your assessment today. What brings you into the ER today?
My right shoulder.
Okay. Did you injure? Have you had any recent injuries or anything?
No, ma'am, but the other day I lifted a patient and I believe I turned wrong.
Okay. So how bad is the pain?
On a scale of 8.
Scale of 8. Is it? How would you describe it? Sharp, dull?
A little sharp.
Sharp pain. Does anything make it any better or make it any worse?
Well, I put a warm compress on it and I take extra strength Tylenols.
Okay. Tell me a little bit about your past medical history. Do you have a history of high blood pressure?
Yeah, I have high blood pressure, I have acid reflux, and I have one kidney.
Okay. What medications do you take?
I take Norvasc 10 milligrams and a Proton 40 milligrams.
Okay. Do you drink or smoke?
No, ma'am.
Are you allergic to any medicines?
No, ma'am.
Tell me a little bit about your family history as far as medical wise.
Well, my daddy died with the stroke, and my mother, she's still living.
Okay, that's good. What do you do for your leisure time as far as any?
Well, I like going to the movies and I like going to the beach and shopping.
All right, well, good. So there's nothing wrong with shopping. We're going to start with your assessment, but we are going to make sure and check your shoulder out in detail as well. But I'm going to, do a full assessment on you.
Yes, ma'am.
Okay. All right. First, I'm going to wash my hands.
Yes, ma'am.
Just going to check your head here for any lumps or nodules. Scalp, there's no dryness of your scalp or anything like that. I'm going to check your temporal artery here. Okay. I'm going to get you to open your mouth for me. Okay, just kind of open it and close it for me. Open and close it. I'm checking your mandibular. Open and close. Okay. Any pain or anything when I do that?
No, ma'am.
Okay. All right. I need you to push against my hand with your face. This way. And back this way. Okay. All right. Get you to clench your teeth for me. Smile and clench your teeth. Clench your teeth together. Checking your trigeminal nerves in here by doing that. Get you to open and close your mouth again. Go check your lymph nodes here. Go check your auricular. Go check your posterior, mandibular, submental, cervical, subclavicle, and your cervical, deep cervical. Any pain or anything when I touch those areas?
No, ma'am.
Okay. All right. Okay. One of the tests that I need to do is I need you to pucker your cheeks, and I'm going to take in a little cotton ball here. You can just relax your mouth now. Take a little cotton ball, close your eyes, and I want you to let me know when you feel me touch.
Yes. 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 Yes.
Okay. All right. Okay. Check your eyes. You can open your eyes for me. Just look straight ahead for me. Pupils equal round and reactive to light. Okay. Just going to touch here. Look down for me. Just checking open your eyes for me and look down. Look up. Any pain or anything when I press here?
No, ma'am.
Any pain in your sinus areas?
No, ma'am.
Okay. All right. Remember this. I want you to look straight ahead towards the wall for me. I see a little light here shining right in your eye. I want you to look straight ahead for me, and I'm going to move in close, okay, so I can look at the inside of your eye, checking the blood vessels and everything in your eye. Okay. Going to check your nose. What I want you to do first is I want you to press on your nose and try to blow out. Have any problems with getting air in and out? I want you to do the other side the same. Okay. Just feeling here for any tenderness. Nose is symmetrical. I'm going to take a look in here. Membranes are pink, and there's no lesions or drainage noted. Okay. We're going to check your ears. Just going to check the outer areas, your mastoid, and look on the inside of your ear. There's no lesions, redness, or drainage. Okay. Tympanic membrane is pearly and slightly concave. Tympanic membrane is concave and pearly green. Okay. Get you to open up wide for me. Okay, lift your tongue up for me. Okay, stick it straight out for me. So move it over to the side. Any pain, stick your tongue all the way out. Move it over to the side. Okay.
Amen.
Okay. Stick your tongue out for me. I'm just going to take and move your tongue over. I'm just going to check the bottom of your palate. Check for softness, any nodules. Okay. Okay. What I need to get you to do is to get you to lay back on the bed for me.
Yes, ma'am.
I need you to turn your head that way. I'm just going to check your carotid. We're going to listen for any bruise. Okay. I'm going to palpate your apical pulse areas. I'm going to palpate the aortic area, pulmonic, mitral area, and tricuspid. Listen to your heart sounds. We're going to listen in the aortic, pulmonic, mitral, and tricuspid. Listening for any bruise in your aortic area. Okay. I'm going to slip your gown up here so I can do an abdominal assessment.
Yes, ma'am.
Just checking your liver. Okay. Get you to turn over to this side for me so I can palpate your spleen area. Okay. You can turn back over on your back. No, not quite done yet.
Yes, ma'am.
Gonna check you for any tenderness. Any tenderness in these
No, ma'am.
areas? Okay. While we're here, I'm just going to feel here for your femoral artery. Okay. Need you to uncross your legs for me. Okay. Just going to assess your skin, temperature, and your legs. Okay. I'll get you to bend your leg up for me. I'm going to check your popliteal pulse and your posterior tibia, popliteal pulse, and your pedal pulse. Just going to take your shoe off here, okay? Okay. Pulses are 1+. I need you to stretch your legs out for me. I need you to bend your toes back up towards you. Bend them all the way up towards you. Any pain in those areas in your calves or anything?
Yeah.
Need you to push against my hands. Okay. I'm going to check your hip here. I'm going to just externally rotate this out. Any pain when I do that?
Ma'am.
Any pain when externally rotating there?
Ma'am.
Okay. All right. I'm going to get you to sit back up for me. And just swing around on this side of the head. All right. Get you to hold your arms straight out like this for me. I need you to try to push in on my hands. Out. Okay. I need you to do your hands straight out. Up. Move your fingers out. Move them back in. I need you to touch your fingers on each hand. Okay. All right. I need you to touch my finger. Okay. With your other hand. Okay. Okay. All right. Now, if you can put your arm straight out like this, I need you to touch your nose starting with. Okay. Yeah. Okay. Now put them down beside you. Are you able to lift your arms up behind your head?
Yes, ma'am.
Is there any pain when you do any of that?
No, ma'am.
Okay. Just gonna check you here for any sensation for dullness and sharp feeling. Just checking your sensation. Should be sharp feeling.
Yes, ma'am.
Can you feel that?
Yes, ma'am.
What does it feel like? Is it dull or sharp?
Dull.
Okay. Just going to check your lungs down here, your expansion. If you can take a deep breath for me. Out. Another one. Okay. Let's palpate here. When I tell you, say 99 for me. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay. I'm just going to check your cervical. Okay. Take a listen to your lung sounds. Take a deep breath for me. Deep breath. Okay. All right. What I want you to do is to stand up. I'm going to do a check your gait. I want you to stand, close your eyes, put your feet together. Okay. Do you feel off balance or anything?
No,
your
ma'am.
eyes closed? Okay. I want you to open your eyes. I want you to walk over here. I want you to do heel to toe. Okay. Walk it. Okay. Get you to turn around for me. This time I want you to walk on your toes. Okay. All right. And going back, I want you to do it with your heels. Walk on your heels. Okay. Very good. Any pain or anything
No,
when you're
ma'am.
doing that? I'm going to get you to have a seat back on the bed for me.
Yes, ma'am.
Okay. One other thing that we needed to do, I needed to also check your hearing.
Yes, ma'am.
That's one other thing that we need to do is to check your hearing. So I'm going to do one of the tests. It's called a whisper test. Okay. So when I'm going to just touch you lightly here on your ear, and then I'm going to whisper something in your ear, and I want you to repeat it for me. Okay. Okay. The next test that we're going to be doing is the we're going to do the Weber test. Okay. Tell me which ear you hear the loudest. Is it equal?
Equal. Equal.
Okay. All right. That completes our assessment. Thank you for your cooperation, and there is one other thing that I need to check, and that was the most important thing because that's what you came here for. So we're going to check your arm completely. Even though we did the range of motion, I just want to feel here and make sure that we don't have any swelling, any crepitus or anything like that in the joints. And I need to check your reflexes also. Any pain or anything in
No,
there? Any
ma'am.
deep pain?
No, ma'am.
Okay. Okay, let's check your reflexes. Okay. Okay. And check your knees. Okay. All right. Now that completes our exam for today. Thank you for your cooperation.